Hi everyone, my name is Megan Conchar. My faculty mentor is Dr. Lindsay Mercom. We are from the Human Animal Wellness Collaboratory from the Department of Psychology, and our study is on the predictive risk factors of secondary traumatic stress and compassion fatigue in animal rescue workers. So we know that animal rescue workers have the highest rate of suicide among all American occupations. And according to the CDC, 1 in 6 veterinarians have contemplated suicide. So these statistics are staggering, and we wanted to know why. So the objective of our study was to determine the individual and workplace characteristics that are predictive of secondary traumatic stress. So what is secondary traumatic stress? This is a kind of psychological damage that results from bearing witness to suffering on a regular basis. Now for animal rescue workers, this suffering is of animals that are potentially abused, neglected, surrendered, or euthanized. Some symptoms of secondary traumatic stress include anxiety, insomnia, depression, and reduced productivity at work or reduced motivation. So the method of our study involved 3 phases. The first was a screening interview where we talked to shelter directors about the workplace characteristics. These included the shelter type, public or private, the annual animal intake, the annual funding of the shelter, the average length of stay, which tells us how quickly the staff can successfully place an animal, and the live release rate, which tells us about the rate of euthanasia in the shelter, and the enrichment, whether or not the shelter runs an enrichment program for their animals. The second phase of our study was to select sites based on this criteria in phase 1. And the third phase of our study was to distribute an online survey to the shelter staff to measure our outcome variables. These variables included individual characteristics, the occupation type, the salary, the hours worked per week, the length of time working in the field, and one's marital status. And of course, we measured our variables, which were secondary traumatic stress, professional quality of life, and attitudes and perceptions of the job and the occupation. So the sites that participated in our study involved shelters that were in New York, New Jersey, and Florida. And the occupations we were studying included veterinarians, veterinary technicians, humane law enforcement officers, animal control officers, adoptions counselors, and those who worked in finances of a shelter. So when we analyzed the different workplace characteristics, we found that shelter type was a significant predictive risk factor. So a little bit of background on shelter types. There are private limited admission shelters and public open admission shelters. So usually the private shelters take in less animals, they receive more funding, they usually have shorter average lengths of stay, so they more quickly place animals into homes. They usually have smaller or larger live release rates, which means they euthanize less animals. And on the contrary, public open admission shelters usually take in more animals, they have less funding, they usually have longer lengths of stay, which means it takes them longer to successfully place animals. And they have smaller live release rates, which means they're euthanizing more animals. So what we found was that private limited admission shelters have lower rates of secondary traumatic stress, have higher professional quality of life, and have more positive attitudes and perceptions of their work and their workplace. And public open admission shelters report the highest levels of secondary traumatic stress, the most positive attitudes and perceptions of their job, and the highest professional quality of life. When we compared individual characteristics, we found that job type was a significant predictive risk factor, such that those who work in finances of a shelter report the highest levels of secondary traumatic stress, the most negative attitudes and perceptions of their job and their workplace, and the lowest professional quality of life. So in light of these results, we are currently seeking to extend our knowledge on this topic in a second study, or a second phase of the study. And so this study is in collaboration with a large open admission shelter that we've identified as at risk. And we're working to administer pre-tests where we first measure secondary traumatic stress, attitudes and perceptions, and compassion fatigue in a staff, and then implement an intervention for those problems in the staff. In that, we're presenting the staff with intervention videos that involve real successful adoption stories of animals that they've placed into homes from their shelter. And then again, we measure our outcome variables in a post-test. And the goal of this study is to see a reduction in secondary traumatic stress, improved professional quality of life, and improved attitudes and perceptions of the workplace. So some future directions for this research would involve continuing to study animal rescue workers because they're an understudied population, and also extending our knowledge about the evaluation and treatment of secondary traumatic stress in other helping professions, such as police officers, military, firefighters, and other professions. And finally, we'd like to recognize the Summer Scholars Program and express our gratitude to them because without them, our research would not have been possible. So thank you.